Hey, good afternoon and welcome. We're here with another installment of our COVID-19 Task Force Town Hall. I'm Joe Salemi. I'm the Deputy Executive Director here at Landscape Ontario, and today's focus of our Town Hall is mental health in the workplace. Stress and anxiety are normal reactions to uncertainty and things that might harm us. For many of us, COVID-19 makes for a very uncertain future. People worry about their own health, the health of their loved ones, both here and abroad. People may also have a lot of concerns around school or work, their finances, even the ability for their business to operate as we enter red zones and lockdown in some locations. And their ability to take part in important community and social events and hobbies and other important areas of their life. People who already experience a lot of anxiety may find their anxiety worsening. As workplaces continue to navigate and respond to the new and unique challenges resulting from COVID-19, it's important to develop strategies and plans for promoting and maintaining psychologically safe workplaces. Maintaining employee mental health and wellness during COVID-19 is just as important as maintaining physical health. There are many strategies that can be adopted across the workplace during this time to help build a resilient and mentally healthy workforce. Today's town hall is being recorded, and we'll send out the recording shortly after the live broadcast. And please use the chat on your right-hand side to pose questions to our panelists and to engage in conversation with the audience. Today we have Margot Byers, part of the COVID-19 task force from Ladybird Garden Design in Markdale. Dave Wright, our Landscape Ontario president and member of the task force from Wright Landscape Services in Bloomingdale. Alan White, COVID-19 task force chair from Turf Systems in Burlington. And Jamie Riddell, also a member of our COVID task force from Site One Landscape Supply. Thank you so much for joining us. And it looks like Andrew has joined us as well. Thanks so much for joining us today, Andrew. Andrew is with Workplace Safety and Prevention Services, and with more than 25 years of global health and safety experience, he consults in areas such as best practices for health, safety, and wellness, auditing, risk management, violence, and harassment, and psychological workplace health. He's a strong advocate of psychological hazard prevention, noting that mental health issues now contribute to illness and disability as much as musculoskeletal disorders. He's involved in several CSA technical committees for physical and psychological health and safety standards development, and is vice chair of the Ontario Workplace Health Coalition. Thank you so much for joining us, Andrew. Great to see you.
My pleasure.
Thank you. Okay? Absolutely. Yeah, we can hear you just fine. Yeah, we can see you and hear you just great. So I'd like to pass it over to you. I know that we brought you on to talk about mental health and workplace. And if you do have a slide deck, we can get that screen share going as well.
Yeah, I have a slide up. So you should see Beyond the Curve as the first slide.
So all you have to do is there's a little button to turn on your screen share, and that'll allow you to share your screen.
Okay, where do I find that button?
Right at the top of your browser inside the Webinar Jam control panel.
I see Show Taskbar, I see Display Settings, I see End Slideshow. That's all I see at the top.
Oh, okay. So maybe you'll be able to see that now. I just granted you admin status. Right beside your camera and your microphone, you should see a little computer, and it'll say turn screen share on.
I'm sorry, Scott, I don't see it.
It didn't come up for you?
No.
So in the meantime,
your microphone link in your video link.
I'm sorry, I missed that part.
That's okay. So right at the top of the screen, there's a little camera and a little microphone on your in the Webinar Jam control panel. So right at the top of our cameras, you'll see a blue button with your camera, microphone, and then a little computer. That will be your screen share button. So you just have to click that.
And I don't see any of those at all.
Maybe they're on the bottom.
There might be one if you move your cursor into your video square, you might see it just underneath your face.
Okay.
In the meantime, Andrew, if you don't see that,
yeah, I can go with my own comments if you want.
Sure, and if you want to send that to me, I can upload it to Webinar Jam, and we can kind of catch up to where you are.
Okay, I'll do that.
Okay.
I do tend to find that slides end up being bigger than what I can send, but that's okay.
No problem.
Let me do that and see how that works. But anyway, in the meantime, let me start chatting with you. Basically, what I would like to do is just sort of review some of the issues and concerns that we're having around workplace mental health and what we can be doing to address it. So we've been working with workplace mental health concerns and issues for the past 20 odd years when we've talked about it from the concept of healthy workplace. But certainly when the national standard was released in 2013, we took a more focused perspective on addressing workplace mental health in the context of what's going on in terms of, again, the overall health and safety picture. So for us, it was really trying to make sure that when we talk to companies or customers or others about the concept of what do we mean by mental health, we talk about looking at it from the context of mental harm prevention versus mental illness. And mental illness is really the conversations for your clinicians and the medical community. What we're interested in is more around the aspects of mental harm prevention, mental injury prevention, as it resonates with the concept of physical harm and physical injury prevention. And I think when we put it in that context, we can kind of realize what we mean by big picture of looking at the whole aspect of how work and the workplace can impact our staff and our people. So really what we want to be able to do is to sort of think of it upon, this is a part of the bigger picture of how we address injury prevention and injury, mental or psychological. So it's really kind of putting it in the same context of what we focused on over the past 150 odd years with looking at physical injury prevention. Now we introduce COVID and pandemic, and we see that not only are the same issues there in terms of how I manage in my own workplace, how work is organized and how we are managed as staff, but I now magnify it by looking at it from the perspective of what's going on with regards to the pandemic. And basically, I don't know, a simple analogy is we're talking about the whole issue around how do I manage my life on top of the fact that I've got this pandemic magnifying all of my feelings, my issues, my concerns that I would normally feel. That could be finances, it could be job security, it could be elder care, it could be child care, all those sort of things. But now I've got to do it in an environment of COVID. And that's really where we start to look at what are some of the things that our staff are going to be facing at a time like this. And so a couple things come to mind. Fear of contracting the virus myself. You know, if I go outside of my bubble, I come back into my workplace, I'm engaging with my colleagues, and I'm worried about that leading to me now contracting the disease and illness. Because I know that even if somebody in my department or my team or my group, you know, if they test positive, which is beyond my control, but it will certainly impact me because if I'm in contact with the individual, I'm now going to be quarantined for the next 2 weeks. And depending on how you pay your employees, if they're contract workers or they're on basically, you know, pay by the hour when you show up, it's going to be a financial penalty for me to be going off work for 2 weeks while I'm just trying to determine whether or not I've been exposed or not. We've got people working from home a lot more today. So not only are we dealing with the work issues in a new environment, I'm working at the kitchen table, and then I've got to clean up the kitchen table at the end of the day so that I can now get dinner ready. Those are going to be new issues and concerns for us. Many of the folks in your community are going to be worried about their own job security. They're going to be worried about isolation. And I'll talk to that a little bit more at the end of the presentation. But looking at what that's going to mean in terms of being away from my colleagues and such. An important component here is we're talking about physical isolation or physical distancing, not social distancing. And that's an important piece for us. We have aspects of dealing with, we're now on top of each other 24/7 in terms of who's in my home with me. So I'm worried about my kids, I'm worried about my partner, maybe my parents. And no surprise that when we watch countries coming out of the COVID issues, that we see a lot more usage of things like divorce lawyers and support groups and the like counselors to help us rebuild our relationship that's been strained over the last 10 months per se. Then, of course, we've got all the aspects of what goes on in terms of self-medication and the like. And this plays a real risk to our mental health. The loneliness and isolation component are two aspects that really do impact our mental health. And as such, maintaining some of the social connections that we have, and whether that's friends or family or colleagues, is an important piece that impacts what we're going through. If you're in a position where you're now going to be bringing people back to work, you're going to have employees that are going to be wrestling with all of those emotions. But on top of that, they may be eager to return and get back in touch with colleagues and such, which is great. But we may also have a group of people that are going to be eager to get back to work, but are going to be worried about health and safety. We're going to have people that are also anxious about coming back to work because of their own health concerns. I'm going outside of my bubble now, and I now have to catch a subway or a bus or whatever, public transit, to me to get back to work. How do I make sure I stay safe? And again, some of our employees are going to be struggling with childcare, elder care, and the like. One of the things you can be doing is start the conversation now. So as your people are engaging with returning to work, managing through this, the best thing we can be doing is have conversations, discuss expectations, recognizing that we're moving to a new normal. We're not going to go back to the way things were. It's going to be taking into account what we've experienced over the past 11 months and how does that apply into the future going forward. If you're in the leadership roles, being able to say, I don't know, is okay. What we're looking for is transparency, and we're looking for optics in terms of making sure that people are hearing what we have and what we don't have in terms of information. So I don't know what that's going to mean for us, but we're going to work on it together. It can be an important piece. Listen with empathy, attention, and respect. Recognize that training in the areas of psychologically safe leadership, areas of emotional intelligence, mindfulness, those are all things that can help us in the long term be a better value to our employees. Recognize as well that anxiety is a natural survival mechanism that we've used as human beings for thousands upon thousands of years. This is our fight, fright, or freeze mechanism. And basically, this is an automatic response mechanism that basically kicks in before we even think about it. And this is where, again, we get into situations where we're anxious, where the anxiety levels are high, what we call the stress levels are high. And as such, what can we be doing to help people manage through that? And there are all kinds of different techniques. You could be looking online with things like cognitive behavioral therapy and the like that can be support mechanisms for people. But basically, the bottom line is, how do we kick the brain in to help us dial back or bring down to normal, again, those feelings of anxiety? And some of it, you hear about it seems so simple, but things like take a breath, breathe, slow down, try to do something that kicks the brain in. And this is really where the brain's logic mechanism can come in and help us dial back the anxiety issues. Things that you can do as managers to support your staff that are in anxiety situations. You may want to keep in mind, again, what we talked about with empathy, meaning you can understand what people are doing in their shoes and be willing to support and listen to where they are. Let's talk about the risk. when people are addressing anxiety and you're hearing them talking about things that seem to or could imply hurting themselves or others, this is where you really have to dial up your response. This is where you really have to be looking at crisis and distress support and that sort of thing that goes with that. Be flexible. It's really about wanting to make sure that, some of the old school maybe issues and such that we talked.
You're on mute, Joe.
Helps if I unmute. It's like the phrase of 2020. You're on mute. Andrew, if you are still with us, it looks like your connection has frozen. So if you're able to rejoin, that'd be great. But in the meantime, I think Andrew has talked on and he has hit on some very important points. And I'll pose this to the group while Andrew tries to rejoin us. As leaders of our organizations, leadership can be pretty lonely, and it's hard to have conversations about anxiety and mental wellness with others in the organization. So how are you as leaders of your organization surrounding yourself with either the right people or putting the right mechanisms in place for yourself so that you can be a resource for your team? And Dave, I'll start with you.
Sure. So you know what? Being part of the task force was a huge help for me getting through the stress of getting back and working early in the spring, knowing what was going on, and being able to talk frankly about what's going on. And then lots of phone conversations, talking to my management team. And being very open about the stresses of dealing with everything. They're talking to me about the stresses of dealing with people and how they're dealing with the whole situation. Really, it's just about communication and just being open and talking about it.
Right on. Thank you. Alan?
Yeah, I think it's, as leaders, it can be lonely if you make it lonely, or you intentionally build networks, which was part of why, as a board of directors, we formed this task force in the early days. Actually, at a board meeting, I think we met a day after the board meeting because we felt this was going to be an urgent need. And as leaders that have felt the lonely experience, how important it is to build up peer networks. Being a resource to others, encouraging others to build those networks, and so on, has helped on the external. On the internal, Dave's 100% correct. Communication, from your frontline workers right through to your management team, and having a two-way conversation that shares with them the proper knowledge to make informed decisions, and really gathering from them their feelings and solutions to the problems that are being presented. Allows them to feel a big part of, I think, mental health is control in a situation that really doesn't have the control mechanisms as human beings that we traditionally need. So I think putting those two things in motion, being open, having frank conversations, I know it's okay to just tell people how you feel, or where you're having issues at home or with financial. It's more than just talking about the mental health. It's as leaders anticipating where are they going to struggle, where are anxiety points, and then doing what you can in your procedures, policies, the way you're operating your company. Even just managing COVID things to report on it. Don't make it more burdensome on them. Try to find ways to make it easier for them to get the answers and to participate and to find those securities that they need to do. So I think it's a really cognizant part on all of our part to make sure that's happening on a daily basis, and not creating more stresses by managing the stress.
Yeah, no doubt. Margot.
So I'm a sole proprietor. I have no employees, but I do have subcontractors that I work with on a regular basis. So what I had done, and this was part of being on this task force as well, I had contacted all my clients and at the same time the subcontractors that I work with, and we went through what the protocols would be, how things would be done when we are on their site, what I expected of their clients, what the clients expected of me, what I expected of the subcontractors. There was a constant communication with everybody, and we all agreed on what we were going to be doing, the distances, the masks, the hand washing stations. And I asked everybody to sign an agreement, which they all did quite happily. So it's been very manageable. Now I don't have a huge staff, and I just work with a few subcontractors, but it is good to talk with the people that you're working with, whether they're employees, clients, subcontractors, about what your expectations are. And if they can't meet those expectations, what the repercussions would be. Like if I'm on site and there's a subcontractor that's not wearing masks, I leave. I don't go on, in the building. I don't go on site. And they know that.
More from a mental health perspective, though, Margot, like with a small organization, it might be even more challenging to surround yourself with with a team, as a support mechanism. So, what were some of the things that you did, both early on and I guess up till now, to fill your support network?
Well, trying to get involved with, being on the task force was huge because we met quite regularly. So there was that social aspect there. I'm also involved in other volunteer organizations, so that helped as well with the social connection. And just, kept in contact with the contractors to make sure that everything was okay with them. And I have the luxury of my property is quite large, so I can go for long walks or short walks if I'm feeling anxious, and my dog always needs regular walks, so she keeps me grounded. But it is worrisome still because you are by yourself. But I try to do Zoom connections as much as possible with family, friends, outside of work as well, and then getting involved with the chapter. So I'm part of the Georgian Lakelands chapter on the board, and we have regular Zoom meetings and try to do some Zoom chapter events as well. So it is, you can't do the face-to-face, but there are ways you can do social connection.
Sure. So being social is a big aspect for your support network.
Yeah, well, we're social beings. We can't hide ourselves in a cave. So we have to still make connections, even if it's not face-to-face.
Absolutely. Jamie, what about you? What are you doing to kind of solidify your support network?
Yeah, so opposite end of the spectrum to Margot, I work for a large company, and it's not really that dissimilar from what she's talking about. And all of us will agree that the task force was a huge levy to our confidence, to our happiness when we were going through it. When we actually decided to stop meeting daily, the joke went around the entire room, like, well, what are we going to do? Like, there was actually people were disappointed we're going to stop meeting daily. So it was a genuine connection in that particular group, and I think that speaks really well to our profession. And when I say that, I think I've been working in this industry for 15 years, and I have built some of the best personal, professional relationships I've ever had in my life with people that otherwise would not have met. Whether they're a vendor, a competitor, a colleague, people that volunteer in different organizations. Some of our customers, but the relationships I have with some of our customers go well beyond business, and we can sit and talk from a personal standpoint about how we and our families are doing, right? And I think that's the next part. So when you talk about our profession, it's a really tight network of people that care about one another. It's not an industry or profession of numbers.
right? It's people with names. And that is very different and very unique to this industry. And then when you look at it from the other perspective, is that when we typically have conversations, it's not about one another, it's about ourselves and our families. Yeah. And I think that level of connection that people have in the conversation in today's times is very important. And that helps you to understand in your team and in your support network where people may not be fully disclosing how much help they need, when you can hear how they worry about their spouse or they worry about their mother, right? You can pick up in the tone of their voice how they're feeling, and it really gives you an opportunity to react to that and to provide some coaching or emotional support in those conversations. So it's been a lot of things, but I can tell you, big company or small company right now, there's not enough emotional support you can draw to get us through the COVID times, right? So the more the merrier.
Yeah, definitely. Totally agree. Joe, Andrew, it looks like you've been able to rejoin us. Thank you. Oh, we don't have your audio for some reason. Yeah, we don't have your audio, Andrew.
You got a picture now.
Yeah.
How's that?
There you go.
I'd like to jump on Jamie's comment, because Jamie, there's research that goes behind this, and this was what I don't know where I lost you guys in terms of the presentation part, but there is research behind this whole concept of social connection, and the aspect of what can we be doing even when we think we're doing okay. To your point, being connected with people has a direct impact on our mental health. And so when we talk about, being in isolation or being lonely, when we're now being asked to work remotely or again, confining our bubble and all that sort of fun stuff, it's about the physical connection, not the social connection that we're addressing. But what happens, of course, is that when we physically are going to isolate ourselves, we have a potential for losing some of our social connections. That's our relationships with our family, our friends, and our co-workers. And our research has indicated that, when we have that isolation and loneliness component, that directly impacts our mental health. But if we have those social connections where we know we're around people that we can generate energy from, then that's a way for us to be able to manage and positively impact our mental health. So, Jamie, what you've experienced in terms of real time is the same kind of thing that the research indicates to us is a critical component of what we can do. How do we help folks support their social connections? How do we look at things like, when we're working remotely, how do we connect with people, and whether it's virtual coffee chats or whatever. So you've touched on a real critical point.
If I could, Joe, and to add to your point, Andrew, I think even our own company, which was a byproduct of our activity, which surprised me a little bit, some of our PPE preparation are intentionally paying attention to how people feel, having personal conversations with our employees, putting safety stations up, posters up, hand sanitization areas, temperature readers. All these things reassured them that we cared as employers. And just that action, the number of employees that have come to me again in an uncertain time and just said, thanks, because you make me feel not only comfortable with what's going on, but this is one of my safe places compared to everything else that's going on outside in the world. So you can have these connections that are between human beings on something as simple as how you set up your PPE protocol, because it genuinely shows that you care and they're not just a number. In your tailgates, in your training sessions, to Jamie's point, how are they doing at home? How we set up our financials. Many of us are coming into the off season, just being cognizant of what people are going through to pay their mortgages and other things in all these uncertain times. Having those conversations frankly and openly with your employees helps them understand not only that you care, but you're trying to anticipate and work with them. So that as we as leaders all have our connections amongst our peers, a lot of times they lack that or feel uncomfortable, and this situation has created greater bond that conversation is allowed to happen now.
Yeah, it's a good point. I don't know where I lost you guys in terms of the presentation, but the same principle is, how do we be transparent? How do we be from a good optics point of view, recognizing that you guys are working without a game plan. You know, as leaders in your organization, nobody gave you a plan to be able to say, okay, here's how you manage COVID. You had to find your way. And there's a reassuring factor that says, you know, if you don't know, tell your staff. Like, I don't know. I don't know what the next 6 months are going to look like for us, but we're going to work through it together. I think we can talk to those pieces with honesty and with transparency and say, like, yeah, you know what, we're all in a new world here, and it's going to cause some real challenges for us as we go about working over the next year or two. And I think new normal is a piece to consider, is that the new normal means that we're not going to go back to what we did in February 2020. We're not going backwards. We're going to have to deal with this new normal as it now impacts our work. Mm-hmm. And as I said, credit to you guys as leaders, because nobody gave you the plans or the training to to have you deal with COVID. I mean, this is a challenge for everybody.
Yeah, and it's part of it's the reason for the task force. And when Dave, as our president, asked me to form this committee, a big part of it was to disseminate the information that groups like yourself with WSPS, government officials bringing health information, kind of disseminating that to give the leadership within our community the tools and resources to then disseminate that to their employees. To have a certain, because there was no roadmap, but to at least have the confidence that whatever game plan you come up with in this uncharted area, that you can present confidence to the rest of your team, because that's going to give them the confidence. So while there's so much negativity and doom and gloom in what we're hearing in the news cycle every day, being a leader that provides that hope and a solid plan where a plan didn't exist. And that was part of our work, to make sure that we provide the resources of Landscape Ontario and its board of directors in our network of connections to folks like yourself and your entire team to not only be present, but proactive to chart out this unknown. So again, WSPS has been incredible in helping us through not only come up with workplace safety plans, but to be a liaison and work with our team at Landscape Ontario, to work with the volunteer board that we have here, and to provide real-world tools in a timely way to the membership to provide those securities, because that's ultimately what creates the anxiety and the mental health issues that we're all challenged with.
Yeah, good points.
Another big part of that, Alan, is just a consistency of the information. And I know as part of the task force, we worked hard at maintaining a consistent message. And even up until now, you know, with our whole "Don't Let Your Guard Down" campaign, it's that consistency, because there is no, you know, the media is all over the place. The government is back and forth on what, and people are hearing things that they don't understand. So being able to decipher some of that stuff, you know, all our employees are on social media. They're seeing all kinds of crap out there. Yeah. We're actually monitoring our employees on social media, trying to get the feel for how you know, what's going on in their heads. You know, how are they feeling about things, just by their comments that they're making on and reactions to different memes and stuff you're seeing about COVID. You can then go and have a conversation with them and say, you know what, is that what you really believe? Because that's not at all what you're saying at work. So being able to kind of keep that consistent level playing field so that people can kind of be grounded somewhere.
And I think one of the things.
A question on that, Dave, if I could, of Andrew while he's here, because as I look at this, I'm glad you brought up "Don't Let Your Guard Down," as we kind of worked on that early within our committee and with WSPS. But how do we manage, Andrew? Because we're at this kind of crossroads where there's a little bit of complacency. It's not hard to look around, as Dave said, in the social media circles. There's really two camps out there in the social place, where the persistence of our message, the constant corrections that sometimes put in to try and maintain this "don't let your guard down," but then having various views. There's some that still believe it doesn't exist. There's others that think that we're overreacting, and then there's some that don't think we're doing enough. And then we're also dealing with how real is it all. I noticed during your technical issue there that you came back and put your oxygen on. You've been living with it firsthand. So it's always, how do we manage this without creating, as leaders, the mental health, when you have such varying viewpoints, even within your own teams. So we don't want to be overburdening, but at the same time, we don't want to be complacent. Any insight?
Yeah, it's we're at kind of a critical threshold, I think, now when, remember back to March and we talked about, okay, we're going to shut the province down and we'll do an extra week of closing the schools. So our kids are home for 2 weeks, right? And then we found out, no, it needs to be more than that. Let's talk about, we're going to shut down till the Victoria Day weekend. Then we're going to shut down to July 1st. Then we're going to shut down to Labor Day. And the last date we got was Thanksgiving. And if you look back, since October, there's been nothing about what the future is going to be. Like by Christmas we're done, or by Easter we're done. They're realizing that this is going to be something that's going to take place over an extended period of time. So now we put ourselves and our staff into a situation where I'm not seeing the light at the end of the tunnel. And as such, and on top of this, you say this is your off season. I understand that, but the off season also includes shorter days of daylight, the winter, the whole aspect of folks that do have SAD symptoms in terms of daylight and sun disorders and that sort of thing. And we don't have a date for saying everything's going to be okay. And so, yes, don't let your guard down is a critical component for you. And how do we do that? How do we talk to our employees in the sense that, okay, let's talk about how you don't let your guard down. What are some of the things your staff can say back to you is, yeah, my bubble is my family and I do groceries once a week or whatever. I mean, all those sort of pieces, you don't have to always be the answer, but you can certainly be that catalyst that says, hey folks, we're in a position right now where we got to band together and we have to work through this. For those that don't think that this is real, you're more than welcome to share my story. I'm now almost 10 months in of having what they call post-COVID syndrome, long haulers. And I don't see the light at the end of the tunnel for me. So when people say flu symptoms for 2 weeks, I'm sorry. There's more and more people that are in my situation of not recovering and not knowing when we would recover. So we do have to take this seriously. We do have to recognize that this is killing people. And it's so unfortunate this became a political football when it didn't have to be. This is a pandemic that's affecting the globe, the whole world. Like, you want to talk about a world war? This is probably the closest example of a real world war. Every country has been impacted by this, and Canada is no different. We've had pretty good methodologies, but it does require us to stay the course around, don't let our guard down. What are some of the things that we can be doing to maintain some of that? And I think when you're having those sessions with your staff and the like, it's make it personal. What are you doing to contribute to our don't let your guard down campaign, and go from there.
Yeah, so what I do when somebody says, well, it's not going to affect me, I'm fine, like, for example, my brother, I would say, well, it's not about you. Think about who you might be infecting and how that might affect them, like somebody's grandmother, or you don't know how it's going to be spread, so just take the precautions you need and just do it.
One particular family that brought 12 of their people together, they went through an isolation before they all got together for the weekend, and they tried. They dealt with maintaining a minimal bubble. They had the windows open so that there was fresh air coming in, and the sad part was all 12 people tested positive anyway. So this is a nasty virus that finds its way into things, and so your campaign of don't let the guard down is all that much more critical.
Is there a right way, Andrew, with your experience, and a wrong way? Because just the whole notion of COVID fatigue, this constant don't let your guard down, and then the harsh realities of this is an infectious disease and the stress that comes from that. Is it okay? Is it advised to coach it in the context of mental health? That ultimately we're trying to alleviate anxiety, not create anxiety, but making intentional awareness that that's what the exercise, versus just assuming people get it at this stage in the game.
What you're doing now is you're seeing it's not so much the anxiety piece now, because that's the instantaneous reaction. You know, if you see a threat, you're in the fight, flight, or freeze syndrome at that point in time. And what you're trying to do is coach the brain to be able to step in and say, okay, this is not a real threat. Let's dial it back. Let's get back into the conversations that can alleviate that. But now what you're in is a chronic stress place. And our people are now being impacted by the fact that, yes, this is a longer term strategy that we have to address. So I think we would want to look at what are the techniques or strategies that we have to help maintain people's actions and maintain their bubbles in that sort of aspect. Because really what you want to do now is not think of it from an anxiety point of view, but think of it from the fact that your people are in COVID fatigue now. And so what can we do to coach people through that in order to help them? And I do agree with you. I believe that it truly is part of our mental health. You know, as I said earlier, our research around this whole aspect of how isolation and loneliness can impact our mental health is really what your people are facing now, and yourselves. And so what can we be doing to help address that? And one of the best things to do is that whole aspect of how do you create, maintain, and encourage social connections? Do I have a buddy at work? Do I have a coffee buddy or something along those lines where I can connect in with and help us get through that? And the other part is you need to look at yourself. You're leaders, and you're not exempt to all the same things that your staff are going through. So what are you doing around your own self-care? Because people are looking up to you for guidance and suggestions. So walking the walk yourself. Are you taking breaks in your day? Are you taking lunches? Are you going for a walk? What do you do to help bring your energy levels back up? You know, is it playing with the dog or the family or whatever? These are also critical self-care components that we need to be aware of. And self-care is not selfish. Self-care is absolutely mandatory. Think of the picture whenever you get on an airplane and they talk about, you know, the onboarding exercise where they tell you how to buckle your seatbelt. Like, give me a break. I think I know how to do that. But I also get that picture where the oxygen mask popped down. And what did they say to people? Put your mask on for yourself. That's how you're going to help others. And the self-care component is really the same thing.
Yeah, it's so true. And, you know, Andrew, you spoke about preventing through mental wellness, preventing mental injury, and is all about prevention. So maybe we can kind of go around the panel and maybe can offer some advice on some of those techniques.
For sure. The prevention component is really saying, what are things that in terms of how we organize our work and how we manage our staff? So two very broad topic areas. But the beauty of it is these are things that you have total control over, right? How you decide to organize your work in terms of what the hours of work are going to be, locations, the remote, all that sort of fun stuff are things that you have control over. What we may have to recognize is I still have to do this, but how I do it is an opportunity for continual improvement, to be honest. So it's an opportunity to say, like, why don't we take an inventory of the type of tasks and activities that our employees are doing, whether that's in the field, whether that's dealing with the customer, all those sort of components, and say, okay, if we take that inventory, here's all the connection points. Where would the COVID risk be at its highest? Where do we have the biggest opportunity for improvement? And I think if you're sitting down with your staff or a task team, you know, you position it as almost like you know what, let's make lemonade out of lemons. Let's look for opportunities to be more efficient in our work and more productive in how we do things, and maintaining that sort of physical distancing that's going to have to be part of the work going forward. We take a look at in the prevention side, what are the factors that are going to influence where people are going to feel part of the community, part of the culture. And if you've looked at the national standard for psychological health and safety in the workplace through CSA, you can also look at tools like Guarding Minds at Work, which is available through CCOHS. These are all looking at these workplace factors. We've identified about 13 of them that represent the opportunities to be proactive. And basically, they all center around how we organize that work and how we manage our people. And so whether it's things like workload management, whether it's things like psychological safety, whether it's aspects of looking at job demands and those sort of pieces, all of those contribute to where we could be running into challenges and where staff could be running into challenges. So there's that opportunity from a proactive side. The big thing is, at the end of the day, the task is kind of, almost the lesser. It's the connection that's the important piece. And so if you've got your people involved and they're feeling like they're listened to, I mean, that could be a huge step for us going forward.
So
thanks, Andrew.
Just to build on that, Andrew, we're talking about social connection, and we're talking about our responsibility as leaders. And, that responsibility doesn't end when we put somebody on a seasonal layoff. And this is, as you mentioned before, with sad seasonal symptoms. Yeah. And this can be a very critical part in people's emotional well-being for the year. Heading into Christmas, maybe not seeing their family, now not being at work every day, not having the social connection with colleagues. Our responsibility as leaders doesn't end when we issue an ROE for a temporary layoff. And I think it's really important as a whole that we recognize that. And from a prevention standpoint, we do need to be proactive in managing the well-being of people, even when they're on layoff or temporary furlough. So it's a very important part. I think something as good leaders, I know we will all do, right?
Yeah, I think you want to think of it as that, wherever my staff are, they're still our staff. And so as such, what can we proactively do to reach out, to communicate? Maybe you set up virtual coffee chats. Maybe you set up a buddy system, like any of those sort of pieces where, colleagues can sort of connect with each other. Good point.
Yeah, I think that's important. And Jane, thanks for alluding as we go into the layoffs. It's stressful in itself, but there's other things that we traditionally do, and I'd love to either on the chat line hear what others are doing. Normally, as we go into the season, we're getting ready for the holidays. We're doing those staff gatherings that we would do around a summer barbecue or a staff birthday, and a lot of companies will have Christmas barbecues and things. But this year, most of those things, like in our own family events, we're not getting together for Easter, Thanksgiving, and Christmas. What can we be doing that goes into the season to not make it that much different than previous years, while at the same time having this family connection that goes beyond work? That's been so important over the years, to allow our team and family to feel whole. So we feel it personally when we don't get together with relatives, but it also feels somehow not right to go to a restaurant or bring something in or to mix our bubbles for this one event.
Yeah.
So what are some of the creative ideas of either the panelists here or Andrew, your experiences out there as we come into the holiday season that you're seeing that we can do the same differently and think of prevention and being proactive in taking care of what people need?
One thing that I've been doing is taking some additional online courses, even unrelated to landscaping. One that I've just done recently is how to make sourdough bread. That seems to be something that a lot of people have been doing, but it tastes good and it takes your mind off of other worries. And I'm looking at the online courses that Landscape Ontario is offering as well, and encouraging some of my subcontractors to take advantage of this through the winter months when you're not working, is improve your education, either within the landscape industry or outside. Pick up another hobby, do something that expands your mind a bit.
Margot, you're now my new favorite connection. I love sourdough bread.
Yes, so does my husband and my boys and my neighbors.
Oh yeah, I'm first in line though. No worries. I think the piece here that's really important is take a temperature check of yourself. And this is what your staff are going through as well. So I don't know about you, but I have no anticipation and or positive feelings about this Christmas that we're going to go through. And that's what our staff are feeling as well. What can we be doing to help address that component? So to your point's well taken. First of all, being vulnerable as a leader is actually a critical component of people buying into your story. And so, like, you know what? I don't know what I'm going to do for Christmas. You know, I have a mother in a retirement home. She's got dementia. I tested 4 times negative, even when I was in the full out COVID issue. So I don't know what I am in terms of threats to others or others as threats to me. So what am I going to address that? And being able to share that with people and say, look, this is what I'm feeling, and you're feeling the same sort of things. Let's talk it through. Let's look at those sort of pieces that can address it. And I said, you know, if you're setting up coffee chats or whatever with your staff, even though they're laid off, even if you're doing something once a week or once a month, whatever works for you, are critical pieces. Let me share with you something that may be an opportunity, and that is we're working with a developer out of Saskatchewan to build an app for your phone. And we're just about to enter into the next 6 months testing this app and see how it works. And the whole concept is we're basically looking at how do you improve social connections. And so this app is going to basically walk you through the components of how do you address loneliness and isolation. How do you do this in terms of your own mental health today? And also in terms of let's evaluate and work on building social connections. So the study that we're doing over the next 6 months would allow your employees to basically download the app and play with it, looking at its effectiveness and whatever. Our company has signed up for the study as well. And we did it for 2 reasons. One, it's nice to be ahead of something, seeing new technology, which is fantastic. But the other piece is exactly what you and I are talking about now. My staff are going through the same issues that your staff are. And we're moving into the dark season. We're moving into all that sort of component. If this is a tool that can help us mitigate the loneliness and isolation that our staff are feeling, fantastic. The timing is great. I know it's kind of off to the side in terms of our agenda today, but if you're interested, we would love to have your organization be able to get on board and use the tool. And as I said, for my staff, by giving them something that they can actually use every day, it's about a 2-minute visit to the website to the app, and it's got a whole package of things like modules for cognitive behavior therapy, skills for developing and understanding social connections, all that sort of fun stuff that to me, I think I'm hanging a lot on for the fact that it's going to be one of those positive resources that employees, staff can use while we're distancing. So if you're interested, by all means, after the webinar or whatever, we can always connect and get you signed up. There's no real burden on the employer at all. This is really something you're doing for your employees. When they download the app and put it on their phone, all of their personal information stays with the phone. So it's not stuff that goes back and is Big Brother or anything like that. This is really something that our staff can use. I've been using it since July, and I found that my daily check-ins, it's really interesting about if I'm looking at my anxiety or my depression or other factors associated with that. There's a comfort zone, and I think a reality about how I'm addressing, especially when I go back and look over my last month and see where some of my issues have been. Why did I spike in the middle of the month around my depression issues or any of those sort of things, and looking back what was happening at that time. So that to me is a resource that would be timely.
Yeah, if after the webinar we can connect, we'll get the information. We can help spread the word.
Yeah, we can put that on our resource page, Andrew. No, I like the idea of the app. I love Margot's idea, and I think something we should think about as leaders and employers to help our team members, to James' point, in the off season, take advantage of these courses that LO offers. Sign up your employees just to give them something that distracts, gets them out of their rhythm. Gives them purpose.
Yep.
Because it's going to be I think we're all going to be lacking a little bit of that. So just us having that foresight to figure out how we can engage our team in the off season, challenge them to a certification, upgrade of skills, making sourdough bread. So we all have it. The makers.
Number one priority right there.
Exactly.
But yeah, some just creative ideas to do it. I think it's going to be super critical coming into the holiday season. I know Landscape Ontario has the peer-to-peer network forum out there. It'd be great to hear other members' ideas to go into the holiday season. One, to recognize the holiday season and kind of keep spirits up when a lot of people are going to deal with the realities in family. And again, business entrepreneur leadership tends to be out-of-box thinkers, where at our own personal, at an employee life level, we tend to feel the world is handed to us and we don't get that kind of control. So anything we can do to stimulate different ideas coming into holiday season, as you said, most people realize, because we've gone through this since March, maybe Easter was a little bit of a struggle or what's happening, but now most people realize Christmas isn't going to be the same, but they see that as a negative. So what are some out of the box ideas to make it positive? And at the same time, keep ourselves as individuals safe, but also keep our workplaces. Many of our members will have essential services with snow removal and everything that we need to be at a moment's notice ready to perform. And we really can't let our guard down at this time of year. So yeah, I'd encourage you to do this chat, or with Landscape Ontario's chat forums, that other peers start sharing some ideas going to the holiday season. And I'm sure there's some crazy creative ones out there to help with our team.
You know, one of the other opportunities you might want to consider is, what are we going to do when we open up for next year's work? And do we have issues or concerns that we might say, give to our staff and say, you know, here's a challenge we always have. Is it an opportunity for us to think this through and maybe come up with a new way of doing business for dealing with that piece? So I love the course idea. You know, once a month we have webinars set up, or we go and do whatever you want to do. But I think the other piece is spinning it back to what can improve our workplace are also opportunities for us. And maybe our staff are interested in jumping on to a task force that would deal with, you know, again, dealing with golf clubs or whatever are going to be the issues.
Absolutely. Alan and Andrew, I'll take those as your last kind of closing comments. But Dave, any kind of closing comments as we start to wrap up?
Well, as I say in just about everything, is communicate. So whether it's planning in your business, whether it's just dealing with issues that pop up on a daily basis, it's the same thing with mental health. You got to talk, and everybody's got to talk together, you know, and be open to talk. So.
Absolutely. And we had, you know, early on into COVID, the task force held a town hall, and one of the hosts was Jeffrey Scott. And he said in that town hall that we should be our organization's radio station. And that level of communication, he said, you just can't communicate enough. And great to hear that from you too, Dave. Jamie, closing comments?
Yeah, don't let your guard down from a prevention standpoint, from a PPE standpoint is an amazing slogan, but also relate that to your leadership, right? Don't let your guard down, and don't relax too much on being a great leader through the slower time of the year. Some of us, it's a busier time of the year with snow, and it becomes even more important as we work through the night and sleep through the day. So don't let your guard down from a COVID safety standpoint, but also from a mental health standpoint for yourself and for all your teams.
Absolutely. Thanks, Jamie. And Margot?
Well, one thing, thinking into the winter, when I'm usually not in touch with the people that I work with regularly, I like what you've been doing with the Landscape Ontario staff, having your Friday night social Zoom cocktail hour. I think that's a good way to keep in touch with the people that you work with, and just on a social basis, talk about outside things that you don't need to, that you don't discuss every day about work. Like what are you doing in your family? How's your family? Just connect with them socially and just keep in touch with them.
Yeah, absolutely. And the point there is to make sure that you're not talking about shop. So it's truly a social connection. Mm-hmm. Yeah, absolutely. Well, thank you to all of our panelists for taking the time, and for our audience as well, for taking the time to invest in the importance of mental health in the workplace. As a small business owner and a leader, addressing psychological health and safety of our employees and their concerns may seem time consuming and sometimes outside of our expertise or our role, some would say. Not addressing these issues can have quite an impact on productivity, on health, on interacting with customers. So it's our role as leaders to actively engage with the people that make our businesses run and treat their mental health with the same level of importance as we put on their physical safety. Until next time, I hope you're staying positive while testing negative. Thanks, everybody.